poverty remains to be one of the greatest developmental challenges of the Philippines. While the share of people living in extreme or abject poverty has largely decreased since the 1980s, a significant amount of Filipinos remain poor. The poverty incidence is how many families fall within the poverty threshold. This figure is the amount that a family of 5 needs to meet minimum basic food and non-food needs, which is 13,797 pesos. The poverty incidence saw an understandable resurgence to 18% of the population during the pandemic, which has been declining since 2015. This figure went back down to 15.5 in 2023. Sony Africa from the Evon Foundation argues this poverty threshold is unrealistic, underestimating minimum standards for food, shelter, transportation, utilities, healthcare, education, and other basic needs. Dividing 13,797 among 5 people equates to roughly 459 pesos, making his argument somewhat compelling. Considering this, the threshold does not accurately paint the full picture of poverty in the Philippines, which could be higher than reported. This sluggish pace also reflects in the country's SDG poverty progress, where it achieved none of its 4 adopted sub-goals under Goal 1, with only 1 on track to completion by 2030, with the rest either needing acceleration or being in regress. This entire situation sets the stage for a pernicious or precarious social situation where families cannot sustainably provide their children's needs, which could lead to resorting to crime and exploitation for the parents, or child labor and sometimes sexual exploitation. There are multiple interrelated factors when not resolved comprehensively that hinder poverty reduction. These include, among others, failed agricultural development, attainment of quality education, and external shocks like conflicts, natural disasters, economic crisis, and health problems, which are further aggravated by the incapability of local governments to implement poverty reduction programs effectively. Poverty then becomes a vicious cycle. If poor children face a hostile environment where they cannot finish school, how can they hope to raise their families from their plight? This picture extends to the Bangsamoro Autonomous Region of Muslim Mindanao, or BARMM, considered to be one of the poorest regions in the Philippines. It has around 1 in 3 persons living below the poverty line, consisting of 1.61 million Filipinos and 200,000 families. It has one of the lowest life expectancies, having high levels of infant and maternal mortality. The region is also ranked the lowest in reproductive health, as they are lacking in modern contraception, birth attendance, and health facilities. They also face issues in sustenance, with 440,000 Filipinos or 50,000 families not being able to meet their basic food needs. Due to this, infants are particularly susceptible to diseases and weakened immune systems from malnutrition. In response to this reality, the Philippine government created the Pantawid Pamilya Pilipino program, or 4Ps, in order to reduce poverty, a few years after the creation of the Millennium Development Goals, aiming to break the intergenerational transfer of poverty by investing in health and education of children from poor households. The 4Ps is administered by the Department of Social Welfare and Development by providing conditional cash transfers to Filipino households that are living below the poverty line. Specifically, it aims to reduce poverty through investments in health and education for children aged from 0 to 18 years old, as well as pregnant women. The program has 2 primary goals. 1. Social assistance in short term through cash transfers, and 2. Social development through human capital investments in nutrition, health, and education to break the intergenerational cycle of poverty. Benefits include the following: an educational grant for 10 months in a year covering 1 child per month of about 300 pesos for elementary or daycare, 500 pesos for junior high school, and 700 pesos for senior high school. There's also a health grant of 750 pesos, a rice subsidy of 600 pesos, PhilHealth automatic coverage, and priority in the availment of DSWD Sustainable Livelihood Program and other similar programs. Most would think that the 4Ps is shouldered almost entirely by the national government. 4Ps alone would cost almost half of the budget of the agency of 114.2 billion pesos out of 245 billion pesos in 2024. This bill is partly supported by the World Bank, an international development organization that aims to reduce poverty by lending money to the governments of its poor member states to improve the livelihoods of its citizens. They also provide development policy loans to aid countries in funding policies and programs geared towards economic development. In the Philippines, the World Bank has been a huge contributor to the development of the 4Ps. Since 2010, the World Bank has been granting loans to support the government's policy in addressing poverty challenges. According to the report of the Department of Finance, the World Bank has contributed $1.39 billion towards 4Ps, which was during the time of the Duterte administration. The World Bank has been consistently supporting the program over the last decade through its funding efforts. As such, included in their support is a $450 million funding to finance the health and education of conditional cash transfer beneficiaries from 2016 to 2019. Essentially recognized by the World Bank due to its significant effect in improving the educational outcomes of poor families. Data from 2019 indicates that the total number of beneficiary households is 41% from Luzon, 21% from Visayas, and 38% from Mindanao, with the largest number of beneficiaries coming from BARMM. By the end of 2022, BARMM tallied 339,445 beneficiaries of the 4Ps program, totaling up to 8.94% of the households nationwide, considered as the highest of all regions. Furthermore, around 27,687 of these are indigenous people from geographically isolated and disadvantaged areas. Still within the top are the children eligible for the program, with 594,546, forms 8.11% of the children nationwide. World Bank is not the only international organization that helps BARMM in relation to the 4Ps program. The UN Philippines, UN Food and Agriculture Organization, and UNICEF through a partners forum under the program ensuring inclusive and risk-informed shock-responsive social protection, resulting in more resilient communities in BARMM, pledged to work closely with multiple government institutions in the region in institutionalizing shock-responsive social protection systems to help build resilience locally. Part of the key interventions served to develop a regional social protection operational framework directly affecting 4Ps household beneficiaries. Similar to the BARMM that succeeded it, the regional government has autonomy with its programs and implementations. The agency does not fully know what they do, which adds to why it is difficult to find progress reports on 4Ps implementation. BARMM is allocated funds for the requirement, but it is up to them to manage and utilize the funds, especially with how many are served. Still, program must be aligned with the national government, mimicking most of the structure, and should follow procedures and guidelines issued. They cannot develop their own for a national program like 4Ps. In accordance with the General Appropriations Act, the Ministry of Social Services and Development must report to the DSWD every quarter. Responsibilities like how much each grant is to who is qualified may be decided autonomously, but the development of entry and exit requirements are decided by the central government through the listahanan. Complete transparency may be a challenge. Still, there is hope for effective implementation, as the MSSD is open to partner with government and other institutions. In the second Joint Field Visit 2024 led by the National Advisory Council and the National Technical Working Group of the 4Ps, and in cooperation with the MSSD, the DSWD visited 4Ps grantees to address local issues, concerns, and gaps in program implementation and strengthen convergence efforts both locally and nationally through collaborations. This points to a thrust from the national government in monitoring the status of the 4Ps beneficiaries and leveraging collaboration to address local problems. DSWD also has municipal and area links where their social workers know the implementation and are trained or capacitated with program and case management. Other agencies have a role in the process, like DOH with tracking vaccinations and health checkups in health centers, especially for pregnant mothers, and with DepEd on entry and attendance of children in school. Although it may be difficult to establish a clear link between changes in the 4Ps program, one may find a glimmer of hope in slow but steady progress. Poverty has dropped from 52.6% in 2018 to 29.9% in 2021, the greatest drop in the Philippines. In Lanao del Sur alone, the number of poor families dropped from 64.2% to only 7.4%. Whether all of this changes, for better or for worse, only time can tell.